The city of Miami Beach declared a state of emergency on Saturday due to spring break crowds that have intensified in the past week, with the concern that such maskless, partying crowds could trigger super-spreader events, leading to an increase in cases and a resulting surge. In a news conference earlier today, Mayor Dan Gelber announced an 8 p.m. curfew for the South Beach Entertainment District, along with stoppage of shore-bound traffic on the city's causeways. The curfew will be in effect for at least 72 hours, and possibly longer, as the situation is re-evaluated by city officials. Crowds have clearly been growing and intensifying during the previous week, as the peak of spring break is reached. Gelber remarked at the news conference that, at night, there is no question that it becomes a place that feels out of control. You see things that you realize shouldn't happen, and no community should have to endure. City manager Raul Aquila said that, "We are quite simply overwhelmed," and compared the downtown Miami Beach crowds to a rock concert. You couldn't see pavement and you couldn't see grass. Police have also made hundreds of arrests so far, and had to use pepper balls to break up a large crowd after a fight erupted at a restaurant on Ocean Drive Thursday night. Conditions such as these with large crowds, close contact, and shouting are ripe for becoming super-spreading events, and with variants now spreading throughout the country, even more concerning. Dr. Anthony Fauci, White House chief medical advisor, said that B.1.1.7, the highly contagious strain initially identified in the UK, now likely accounts for up to 30% of COVID-19 infections in the US. B.1.1.7 has now been reported in all 50 states and in 94 countries, and U.S. health officials believe that the B.1.1.7 variant could become the dominant strain in the U.S. by the end of March or early April. Not only is B.1.1.7 more transmissible, but more deadly. In fact, a recent study published in BMJ looking at data from over 100,000 patients in the UK from October 1 through January 28, found that B.1.1.7 was associated with a 64% higher risk of dying from COVID-19 compared to earlier identified strains of the virus. And the potential of a fourth surge from this variant strain is a real concern, according to Fauci. While there are unequivocal reasons for optimism regarding the pandemic, there are still too few people vaccinated to completely behave as if the pandemic is over, said Amesh Adalja, MD, an infectious disease physician, and senior scholar, Johns Hopkins Center for Health Security. Mass gatherings, such as a spring break crowd, remain dangerous potential super-spreading events that can set off chains of transmission that land on unvaccinated vulnerable people. Data indicates that specific locations in South Florida continue to demonstrate increased transmission, as the state has now recorded over 2 million COVID-19 cases.